corneal opacities are commonly encountered in the optometric practice. They are seen in a variety of conditions and have great variance in their appearance. Additionally, there can be significant variance in the number of corneal opacities seen on the cornea. Here you can see two examples. On the left is a video of many small infiltrates across the cornea, with one large scar up to the left from a previous infectious event. On the right are several subepithelial stellate opacities. We certainly want to be cognizant of any condition that causes corneal opacities, but one in particular is epidemic keratoconjunctivitis, or EKC. EKC is one of those conditions that we want to make sure that we're appropriately identifying. This includes a thorough history along with understanding the patient's symptoms. It may be preceded with symptoms of fever, malaise, nausea, or others that are consistent with flu-like symptoms. Patients will have a history of exposure to someone with EKC, but may not always remember it. Patients are typically highly symptomatic and can complain of a number of symptoms, including things like irritation, soreness, photophobia, excessive tearing, and the eye being very red. Physical examination of the acute presentation will often reveal preauricular lymphadenopathy on the same side as the affected eye, with eyelid swelling, conjunctival hyperemia and chemosis, and oftentimes a mixed follicular and papillary response. Oftentimes these patients will also present with subepithelial infiltrates. We're fortunate to have a point-of-care test that's been scientifically vetted to allow its use in a clinical setting with a high level of specificity and sensitivity. The AdenoPlus allows collection of tear sample from the lower palpebral conjunctiva. The test has two lines. The control line, as seen here as blue, means that adequate sample has been collected. The red line is the test line, and if present, is positive for adenovirus. The clinical appearance, along with a positive test, confirms EKC. We will discuss appropriate treatment options in the next episode. When presented with corneal opacities, it's critical to consider history, symptoms, and exam findings to appropriately narrow down your differential diagnosis. Appropriately diagnosing EKC can be done by combining these factors along with the aid of point-of-care tests. Keeping these things in mind will help us accurately identify this highly contagious condition. We hope that this has been clinically insightful.